Well, the impetus for me going to an eye care professional stemmed from a morning wake up where I woke up and there were blotches in front of my eyes. It looked like a Rorschach test, like, ink blots, and it scared the living daylights out of me. I mean, I thought I was going to go blind. I freaked out. I mean, the idea of being blind is just, it's a totality, if you know what I mean. And when I experienced that morning, I was, like I said, horrified. But more than that, I didn't know if it was fixable. When I was younger, I remember seeing horror movies, and one of the horror movies, they would put things in people's eyes, like pins or needles or whatever. And now I'm actually going to have to get a needle into my eye. And not only do I have to get it, but it's going to have to be every single month. It's not something you look forward to. I like to do things with my life. And what I don't put on my list is, gee, I really want to go to the doctor. I would have to come to the eye doctor every 2 weeks or 4 weeks or so, depending on how bad the condition was at the time. They do the scans and they see what happens and they tell you when they want you to come back.
Persistent DME is fluid that persists on exam or OCT testing in spite of multiple prior treatments for diabetic macular edema, such as monthly anti-VEGF injections, or recommended prior treatments that don't happen because of missed appointments or other reasons. In these cases, I think these patients would benefit from a continuous microdose therapy such as ILUVIEN because it continues to release fluocinolone acetonide over up to a 3-year period, which allows a therapy for the patient even if they're missing their appointment due to hospitalizations, dialysis, or if there's a snowstorm and weather prevents them from coming in. These are the type of patients that are very common among my DME population that would certainly benefit from ILUVIEN.
When Dr. Kiernan told me about the possibility of this injection and what it does, in a sense like a seed that's planted into your eye that releases the drug over time, something that I would run to, and that's what I did. Since then, with the ILUVIEN, I've had to go, every few months, every 2-3 months, I go in, get a checkup, see what the scan says. If the edema is still in control, I go on my merry way. The difference that the ILUVIEN has made in my life is that it's been 1.5 years since I've had to have an injection.